Hello and welcome to 20 Minutes. I'm Nadia Naqi with you on Dawn English. We talk about today the health challenges that are at large faced by all the people who have been internally displaced after the climate catastrophe that has hit 72 districts of Pakistan, of which Sindh and Balochistan province are the most affected one. We have with us the Health Minister for Sindh, Dr. Azra Pechuho. Thank you so much for joining us, ma'am. We would like to first have an overview of the province, that how many established medical facilities have been hit by this climate catastrophe.
Thank you, Nadia, for having me on today. Really speaking, we have 1,200 units of our basic and basic health units and rural health centers and our Talka hospitals, about 1,200 units being affected by this catastrophe. In that, the damage assessment has not yet been done fully, but we, because they are inundated, we are sure that these are going to be damaged substantially. Physical damage will be substantial. Unfortunately, obviously, this does not allow us to give services in these units as well at the current moment, right. But we are giving services other than in these units.
Okay, so we have also, the Sindh Health Department has set up mobile units. They have set up medical camps. Is it just the health department doing it, or you have other humanitarian organizations and private setups from Karachi that are helping you out?
So actually, we have initially we have only had the health department setting up mobile units and health camps through our district health departments, but we have now started getting feelers from non-governmental organizations who want to get involved in it also. For instance, I had a meeting yesterday with our Khan University Hospital people. They want to set up some camps in some of the districts and also want to give us three mobile units. So really speaking, other people are now chipping in. I've got Al Khidmat people also saying that they will be interested in giving us some help with the mobile units. So I think, and I'll take this opportunity and use your platform to ask every unit, every non-governmental organization that is working out there to please come forward and help us in creating much more of an outreach to these patients, because the problem again is we are in the process of getting more staff on board on contingency basis, and which includes doctors and paramedics, nursing staff, etc. But we are obviously strapped for human resource. And more than that, we are strapped for medicines. Medicines were for the current quarter, and we didn't have enough medicines for an emergency like this. This is unprecedented, and so we didn't have enough medicines. So I'm approaching pharmaceutical companies also, so that they can donate as much of the medicine as they possibly can.
Because the rains have been unprecedented in the province, and the climate catastrophe is the devastation is so huge that it's still in the face of relief work. As the chairman of Pakistan People's Party yesterday, when he was making the flash appeal to the UN, he said the most vulnerable, especially children, women, and the old, they are facing a lot of health challenges. So when you say there is a dearth of medicines, what kind of medicines are we looking at, and what kind of ailments exist as a challenge?
Okay, what we have obviously had a huge influx of children and the old and the vulnerable population with gastroenteritis. One of the major issues has been gastroenteritis, obviously because of contaminated water. We had a few cases of cholera as well, but now that we are not able to even take laboratory samples and test it for whether we have cholera, but I'm sure there's cholera out there as well. So really speaking, the water is undrinkable. That is another request that we want to send out, that please give us any potable water that is available, mineral water, whatever bottles are available, so that we can distribute it amongst the people so that they get drinking water which is pure, and so it won't harm their guts and all that. We're also seeing a lot of cases of the skin diseases because the water is very corrosive and they're living in almost inside that water. They wade through that water to get to dry areas. Scabies is there, a lot of skin infections, dermatitis, etc., which is skin related problems are huge. We are also seeing a lot of snake bites because obviously, but though we have anti-snake venom because these are water snakes which are being displaced from their habitat, and they obviously they find the driest place that they can, and they can obviously bite the people around them who are now walking almost bare feet with hardly any protection. So really speaking, so there have been ASV cases, there have been snake venom cases, snake bite cases, and we have ASV in the districts to help us with that. But the other things that are now going to pop up are typhoid, for instance, hepatitis, for instance, because this is going to come up as a dreadful consequence of this prolonged stagnant water that is standing there. We're also seeing a lot of cases of malaria because swarms of mosquitoes are now out there because of this standing still water, which is now the breeding grounds for mosquitoes, animals as well. So really speaking,
the aftermath of the flood, and those people who have now possibly either living in the relief camps or even finding some piece of dry land to save their lives and whatever livestock that they have left with. So there are huge health challenges. You talk about the gastro, which has just started, and followed by cholera, malaria. I don't know if dengue would happen or not, but yes, the contaminated water with skin infections. These are huge challenges. So frankly speaking, is there a contingency plan? I mean, the magnitude of this devastation, followed by the health challenges that the health department is facing, would you be able to say, ma'am, that at the moment you're being able to reach out to everyone who's probably needs medical attention?
So really speaking, the scale of the catastrophe is so high that our limited resources, human resource limitations, medical resource limitations is making us, it's stretching us to the limits. I don't think we are reaching each and every one because people are not only in camps, we are trying to reach them if they are in camps, which include schools and colleges where people have taken shelter, and other government buildings in which the people have sheltered. But reaching out to every roadside person who's sitting on the roads. Now, these people have also, with their livestock, are sitting on the roadsides which are dry. So really speaking, like every 2-3 miles, we see a few families parked on the roadsides, and
right.
These are people who it is very difficult for, though we have mobile units in every district, those mobile units are limited, and plus there is also a limitation in the fact that the roads are inundated, so getting to those people is also a difficulty.
Exactly. I mean, I was just thinking that having a lot of mobile units, but if you can't reach out to them because there's water everywhere and there are places that have been cut off even through land, through road networks, because they are inundated, becomes very, very difficult. So in such a scenario, there's also a very bleak picture that UNFPA gives about women who are expecting, and says that about 650,000 pregnant women exist in the flood hit area. Of course, it includes the entire area, not only Sindh, but includes Balochistan, parts of KP, the northern areas. But they say that 73,000 are expected to deliver next month. So I'm sure a lot of them, because 44% of the entire displaced population, that's what the last reports were, are from the province of Sindh, and I'm sure many women are expecting and maybe delivering probably as we speak or probably next month. How are you going to deal with the women issues and all these issues that women face, their hygiene issues, and of course the delivery issues?
These are the most vulnerable population of our population. If they are cut off from any health facility, it becomes very difficult for them. I don't know how they'll cope with their deliveries and this thing. At least we, as much as we can reach them, as much as we can dewater our health facilities, we are trying to dewater our health facilities so that those health facilities can open up for services.
You're being very candid, madam, that you're talking about that, reaching out to each and every person and to actually delivering to them in terms of health is a huge task at hand right now. And you are saying that there's a dearth of medicines, the paramedics. So I would like to know, and you're asking for help from all the philanthropists, from different humanitarian organizations who could come out and help in terms of medicines and human resource and setting up medical camps. I would like to know that, what about already paramedics that existed in all the established facilities which are now inundated with water? Are they being placed in the medical camps that are being set up by the Sindh government?
Yeah. So, really speaking, what we had done was with the doctors and paramedics, we'd engaged in COVID because COVID is almost now not a priority, and obviously it's receding a bit. So what we have done is we've shifted that human resource into camps. See, what had happened was we had initially moved people from our main hospitals into the mobile facilities and to man the mobile facilities and to man the camps, etc. But then we were having a flood of patients coming in with medical or infections into our major hospitals. So therefore, we sent them back to the hospitals that they were serving in. We moved the COVID staff into our camps so that they could handle the COVID camps which we have set up in all the districts.
And while you're dealing with all this, the waterborne diseases and the insect bites, as well as the mosquito bites and all the diseases that you said come in a sequence after the aftermath of the flood, there's also the existing challenges that you have in terms of the EPI program. And because there are many children and there are children that are going to be born, so you have to have a multi-pronged strategy, I suppose, dealing with polio and all the EPI program that exists in place.
Nadia, the unfortunate thing is our polio campaign that was planned for August, end August, it had to be postponed. We only were able to manage Karachi. Really speaking, we couldn't do it in the rural areas of Sindh, and Hyderabad also couldn't be done. So we have preponed our polio campaign for September, but that will also be, we are thinking that if the water doesn't recede, we'll have to carry out that campaign in the camps where internally displaced persons are already there with their children. So we may have to do that campaign within those camps. API program, the vaccinators are going out into the camps and they're vaccinating those children who are in the camps. So this is an opportunity to reach to children, because normally the EPI campaign, outreach campaign was done in villages, and each and every village used to be covered by the EPI vaccinators. But now the opportunity is to get to the camps where these people are residing and to give the children the EPI vaccine.
So, Azra, one more thing I'd like to ask you, apart from all the medicine and the human resource that you require as help, are other provinces also helping you out, especially Punjab and Khyber Pakhtunkhwa, because they have not been so badly hit? And Sindh and Balochistan unfortunately have faced the brunt of this climate catastrophe.
Punjab's chief secretary reached out to us and he said, if you want doctors and paramedics, they were willing to give us some doctors and paramedics. But the problem is that these people they may come from Punjab, but they're not aware of the local conditions. So it may be a little difficult, but we agreed that we would be very happy if they could send us some human resource. We'll see what we can do and how we can place them and use them to the best of their abilities and our abilities to see where we can really get them to go. Obviously, there is KP hasn't come forward at all. So really speaking, we haven't heard from them. But Punjab did reach out to us. Balochistan itself is suffering a huge amount of catastrophe, and really, in fact, they are asking us to help them, and which we have. Unfortunately, we cannot, because obviously the handling of our own province has become such a huge issue that we cannot even think of assisting anyone, though I would love to help Balochistan, because I feel that they're really badly hit as well. And it becomes a human tragedy that one wants to help out as much as possible, but obviously because we are constrained cannot reach out to Balochistan and help them. So I would be, in fact, from your platform, I would say that people should, all the provinces who are not being hit as badly as us, they should help, give out a helping hand to Balochistan as well. And that is critical. I mean, human tragedy and human suffering cannot be put into words. We have seen it. I've seen it with my own eyes. I've seen the way they are suffering, and it breaks your heart just to be able to, cope with it. It has been frustrating. It's also very heartbreaking. Frustration is just happens because you cannot do all that you want to do.
Exactly. I went to some areas, one of the districts, and I saw, these children, these women and men, they're bare feet, and they are, walking towards dry land from within this contaminated water, which is just there. And it's just the water has collected. And even during the daytime, you could see so many insects. And of course, they need clean drinking water. They need medical help, and especially those who are probably already ill for with some disease or the other. So, is there an arrangement for you to, probably airlift those who are like really, really serious patients?
No, we don't have any airlifting facility at the moment here, and I think you see, because airlifting, how many people can you airlift who are sick? And how do you know that these people are sick and they need to be evacuated? Now the problem is, initially we had just the problem of giving them tents because it was raining, and there was deluge of rain and people were under the sky. Their houses kacha houses had gone down, broken down. So really getting them under a shelter was the first priority. We're still facing that priority. Obviously, everyone wants tents and everyone wants to be sheltered. We shifted as many people as possible into government buildings, which were accessible to us. Obviously, they're not enough. Because we have two-room schools in our villages. So 2 rooms cannot. There are 50-60 families in one village or more. So really speaking, getting all the family members into a 2-room facility was not the ideal condition. We couldn't do that, and they wouldn't be able to stay there. So a few shifted there, a few moved out. The amount of internally displaced persons is in lakhs. Millions of people are internally displaced. They're trying to get to as dry a place as possible.
So I do understand. Thank you so much for your 20 minutes, Dr. Azra. You tried your best to tell all of us and all the viewers that, the health challenges now at hand are huge. And to deal with them, the Sindh government requires help. It requires help from international partners. It requires help from within the country, from doctors, from paramedics, from pharmaceuticals, from all the population that could possibly help in one way or the other. But we do hope that, you could deal with all of this. And indeed, the human sufferings is something that you cannot put in words. When you don't have your home left, when you're living in a shelter, when you're living in the least, conditions that are ideal for you, because there's a lot that goes into it. There are women, there are children, there are old people. They all need some sort of medical attention because of the water that has just inundated, and they're just living on a piece of dry land that probably is left for the moment. Thank you so much for joining us. We hope that you can deal with this and we can overcome these challenges soon. Goodbye.
Thank you, Nadia. I'm very, very, very grateful for your channel having me on today, and I hope that we all can face this tragedy and come out stronger. Thank you.
Inshallah. Thank you so much. Thank you.